Okay, we're now going to do skill 2.28, administering Otic medication. Otic medication pertains to the ear, okay? So we're going to do all of the stuff that we would do before, you know, when we got it out of the system and all that, okay? So do all of that. I am picking up here at this video with how to actually administer it, okay? So what you're going to do is you're going to make sure that you have gloves, and you're going to put them on, okay? I'm putting my gloves on. And you would use a Q-tip, a cotton-tipped applicator in solution, so some normal saline on it, to clean the ear. Let me go get one so I can show you what I'm talking about. Hold on. Okay, so I couldn't find a Q-tip here, but I found a stick, and I'll show you. So what you want to do is you want to just clean right here. So I'm cleaning just right here at the end, okay? I'm not going into the ear. That's a no-no, okay? No going into the ear. It's just the outer aspect here, okay? It's what we call the pinna and the meatus of the ear canal, okay? So it's just right here at the beginning, okay? You're going to clean out anything that's there, okay? You're going to warm the medication container in your hand. So you're just going to hold the medication in your hand and get it a little warm. Could you imagine putting a cold medicine in your ear? Oh, that just does not sound like fun to me, okay? So I really want to make sure that it's warm. You can hold it in your hand, or you can put it in some warm water for a short time, okay? We don't want it hot, okay? But we want it a little warm, okay? Now, if you had an eardropper medication, you would put the medication in a dropper, okay, and like this, right? And you would drop it into the ear, okay? I'll show you how to do that in a minute. For this, we're going to actually use a medicine that looks like this, okay? A medicine dispenser. Like a normal, well, I shouldn't say normal, because not all of them are like this, but majority of the eye solutions will come in something like this, all right? Okay. So you're going to straighten the auditory canal and instill the correct number of drops alongside of the ear canal, okay? So what you're going to do is you're going to take the ear and you're going to pull back a little, because you're going to straighten out that ear canal a little. Now, I don't want you reaming on the ear, okay? I don't want you, let me show you my ear, okay? I don't want you doing this, all right? Because that really would hurt. It's just a general, oops, I'm trying to get it in. It's just a gentle pull up and out kind of thing for your ear, okay? So, did you see how that moved my ear? See that? Okay? So it just opens up that ear canal, okay? All right. So now back to the patient. Let's see if I can zoom in a little bit. Whoops, whoops, whoops. Too far. All right. Whoops, too far again. I'm not trying to make you dizzy here, people, really. Okay. So, we're pulling up and out, right, for the ear to open that ear up, okay? And what we're going to do is we're going to straighten the auditory canal and instill correct number of drops alongside of the ear canal. So, rest your hand on their side of their face, okay, and put in the amount of drops. You can get this close, but you don't want to rest it on the ear, because when you rest the medicine dropper on the ear, you actually contaminate this and the medicine that's inside of it. So you literally are just going to rest it on your hand, okay, and drop it into the ear. 1, 2 is my order, okay? Now, then, after I've instilled the drops into the ear canal, I'm going to press gently but firmly a few times on the tragus of the ear. And you're saying, what is the tragus or the tragus of the ear? And that's that part right here, okay? So it's one, you know, just a couple of pushes, okay? And it helps to get that medicine down into the canal, okay? So The tragus or the tragus of the ear, I'm going to show you on myself, is this part right here. Can you all see that? This part right here. Hopefully you can see that, okay? No, I'm sorry, right here. Right here, okay? It's this part right here. You see that? See that part right there? Push it right in. You got that? Okay. All right. So, after you've done that, you're going to insert a small piece of cotton fluff. What's cotton fluff? Just a small piece of the cotton ball, okay? And you can just rip the cotton ball like that. Make a another little cotton, and just stick it in the ear like that. Okay? You see that? So that's just a little small cotton fluff. Okay, you're going to put it loosely in there. You're not going to jam it in there, okay? And it's for about 15 or 20 minutes after you've instilled the medicine. So at this point, you don't have to stand at your patient's bedside. You can remove your gloves, wash your hands, you know, do all of the exit procedures that you would do to go out of a patient's room. But you would come back in 15 or 20 minutes. You put on, you know, some gloves and remove the cotton from the ear and assess them. How are you doing? How are you feeling? Did that medicine seem to help? Oh, good. I'm glad. You know, so just assess your patient, okay, 15 to 20 minutes later, and you would document that you did assess. You would also have documented, after you instilled the drop in the patient's MAR, the time and how much medicine and your initials and all that, okay? So that is skill 2.28, administering Otic, potato, medication, okay? Thanks.